we're all at one time or another a patient, but I guess we're all on the go, and we all have a cell phone in our pocket here. So we're all carrying mobile devices. And if someone told me when I was at CES 10, 12 years ago that I would be monitoring my health care through my cell phone, I'd tell them they were crazy, because I can remember when there wasn't enough towers in this town to handle the number of cell phones that came to Comdex and CES. You couldn't even get a phone call out of here. So thinking about monitoring my wellness or my health care or my chronic condition on a mobile device, I would have thought you were crazy, but not today. So wireless healthcare is here to disrupt. And so, sorry about that, but sometimes you get a little tongue-tied. So this is going to be a very interesting panel focusing on this whole area. And at this point, I would like to introduce Brian Dolan. And Brian, prior to founding MobiHealthNews.com with business partner Joe Mullally, Brian was a senior analyst with the Boston-based research firm Yankee Group, where he led a program for the company's Mobile Internet World event and helped craft the company's publication development. Brian got his start in 2005 as editor of Fierce Wireless, a leading trade publication in the wireless industry. So our moderator knows what's going on here. He looks under every rock and finds out what's hot, what's not. So let's bring Brian up to the podium.
Thank you, Susan, and thank you for having me here today. So we've got a great panel discussion for you in the next 45 minutes. Unlike some of the last sessions, we're not going to do any slides. It's just going to be discussion. So we're going to do some moderated discussion to begin, and then hopefully get a lot of time for Q&A from the audience. So before we begin, I think we've had a great base in terms of some of the metrics surrounding the wireless health opportunity, both this morning and also in the Qualcomm CEO Paul Jacobs' keynote yesterday. But just to review, as Susan noted, most of us do have mobile phones. It's close to 90% penetration in the U.S. 4 billion users worldwide. It's 276 million in the U.S. And on the flip side of that, on the health side, there are about 140 million people in the U.S. with one or more chronic conditions. Is there consumer demand for wireless health services, for mobile health services? A couple of recent surveys suggest that there is. PricewaterhouseCoopers found that about 3/4 of the U.S. is interested in tracking their vital signs, which is just a massive figure. People are very interested and intrigued by some of these technologies. And that points to a growing trend in what's called the quantified life. People are looking to track just about anything they can about what they do, including their health metrics. Another survey by Harris Interactive and CTIA, the Wireless Association, found that more than 70% of people were interested in mobile health services in particular. Those are health services offered via the mobile phone. So again, that points to a lot of consumer demand. In Paul's keynote earlier today from PricewaterhouseCoopers, he mentioned that he noticed a recent trend in non-traditional players entering the healthcare market as service providers. And that's certainly true for the wireless industry and the telecom industry. Just in the last 2 months, both Verizon and Vodafone established business units completely focused on healthcare. So clearly those are two non-traditional players for healthcare entering the market very recently. But on the flip side, and maybe even more interestingly, I've noticed some of the healthcare providers are actually non-traditional wireless service providers. They're entering the mobile market. Mayo Clinic just this week formed a startup focused on mobile medical applications for the iPhone and other smartphones called M-Remedy. So just as there are telecom companies entering healthcare, there are healthcare companies entering the wireless industry as well. We heard a little bit about some of those initiatives from Partners Healthcare's Center for Connected Health. Doug McClure mentioned their recent spin-off, SmartBeat, which focuses on connected health solutions as well. So there's another example. So without further ado, we're going to get to the discussion here. We have a great panel, as I noted. To my immediate left, we have David Inns, who is the CEO and president of Great Call. You might know them better as Jitterbug, which is their mobile phone service. Next to David, we have Don Jones, who is the vice president of business development, health and life sciences at Qualcomm. Next to Don, we have Mike Foley, who is the executive director of Bluetooth Special Interest Group, SIG. And next to Mike, we have Kent Dix, who is the CEO, chairman, and founder of MedApps. So to begin, I think it's probably a good idea to get a definition as to what wireless health is and what is the wireless health opportunity. Keeping in mind that there's been a lot of overlap today, our focus is squarely on wireless. So I think if we could begin with Don, what makes this panel distinct is that wireless focus. So what is wireless health, and what does wireless in particular enable that maybe some of these other connected health solutions don't necessarily achieve?
So wireless health is an interesting term because it sounds great, but no one quite knows what it means. What we like to think wireless health means is that you have the opportunity to collapse time and space. And what that means is make things happen faster than they would otherwise happen. And that's the value of wireless, because at the end of the day, wireless at the end of itself is connectivity. Wireless applications on your phone start actually looking like something that you might be interested in. But from a technologist point of view, the way we look at this is thinking that if we can make things happen faster than they otherwise would in the healthcare system, there's going to be economies of scale and conveniences for the consumer. So from our perspective as a technology company, that's what this is all about. From enabling the medical devices themselves to be connected, it's about making sure the devices are doing what they're supposed to, being able to opportunity to remind folks to do what they need to, and in many cases actually innovate around game theory and actually make healthcare engaging and fun.
And just to clarify, when you say making things happen quicker than they typically would, can you give an example of how that would work?
I've got one right here I can use. So let's say you're a new expectant mom and you're in for your recent ultrasound, and you'd like to actually take the ultrasound and distribute it to your friends, maybe put it on Facebook, maybe create the baby's Facebook page. How about if as you leave the doctor's office, literally before you're out the door, you have the ultrasound on your smartphone, and you can take it, share it, put it on Facebook, etc. Now imagine this with all your images, X-rays, CTs, MRIs, etc., before you leave the office. This is actually from a company called Great Connections. It's actually commercially available today, launched in Sweden. So there's an example of making things happen faster than they would have otherwise happened in the traditional medical world.
Great. Thank you, Don. And David, I'm not sure if you were here in some of the earlier sessions, but there was definitely a bit of a gauntlet throwdown in terms of whether seniors are capable of using mobile phones. So I definitely thought of you when I heard that. But just as a broader question, which group or groups in particular do you think are likely to be early adopters of wireless health, and which will benefit most? And there might be a difference there, but also how do we go about encouraging those that could benefit from these solutions most? How do we encourage them to actually adopt these services?
It's definitely going to be different, the early adopters versus the ones who can benefit the most. I mean, I think the 60-plus population is approximately 15% of the U.S. population, but is currently accounting for about 40% of the healthcare expenses in the country. So if we're really going to make an impact there, it has to be in that group. So we believe that's where wireless health can make the most impact. So then the question is, what do we have to do to actually make that happen? Because absolutely, seniors can use cell phones, but what we really have to do to make it easy and fun to use, because that's where I'd say what another thing wireless health means to me is you can make things easy, because there aren't things to plug in, that everything can work very seamlessly with very little interruption. So there's 4 things that we believe you'd have to do to make this work for seniors. One is the devices would have to be easy to see, easy to hear, and easy to use. The second thing is that they'd have to be very easy to set up. They'd have to come out. If you're sending some new customer, they would arrive completely set up, and that would also include any kind of connectivity that has to take place would all take place seamlessly, without pairing, without having to do setup, that it would all be very, very easy to use out of the box. That's the only way you're going to get this to have high compliance. The third thing is really going to be that if there is anything that's going to operate on the computer, you better not make it a fat client, because that's going to be another big problem. All of it needs to be internet-based, cloud-based, so that it's very easy. No one has to download anything to their computer. You just go to a website and everything will work. And the fourth thing is great customer service. I think that's one thing that is missing in a lot of the conversations I hear about wireless health, or about M-health in general, or e-health, is you have to be able to provide the customer service.